As we see in this next slide, the United States is on the bottom of the list of wealthy nations for overall healthcare ranking. The question is why? We're spending more money on healthcare than any other nation in the world, and yet we are not getting the results we should be seeing. What is involved in bringing about this kind of outcome? Well, there are probably various answers to this question, but one of them is that unlike all of these other nations on this graph, the United States does not have universal coverage, meaning that not all of our population is covered by health insurance. People without health insurance get less health care. They go to the doctor less often. They end up being conditioned to try to avoid going to the doctor and incurring healthcare costs. Uh, all of these countries achieve universal coverage through various means. On one end of the spectrum is the United Kingdom, Great Britain, which has a socialized medical system, meaning that their healthcare is essentially run by the government, and medical people, doctors, nurses, etc., essentially are government employees. It's a socialized form of medicine. On the other end of the spectrum is Canada, which does not have socialized medicine, but does have universal coverage through a single payer system based on their provinces which relate to states in the United States. All of these countries have universal coverage. They also do not have the kind of competitive for-profit systems, decentralized, that exist in the United States today. They tend to have a higher regulatory environment which controls how people receive health care and the quality of their health care. If we were to go to a single payer system like the Canadians have, that would probably be along the lines as has been proposed of a Medicare for all system. As it stands today, millions of Americans are either uninsured, have no health insurance whatsoever, or are underinsured, meaning that their insurance, they do have health insurance, but a lot of the costs still are incurred by them, and that discourages them from seeking medical care when they need it. So we have millions of people in the United States tend not to seek medical care unless they absolutely have to. That is different from all of the other countries on this list. As we see in this next slide, infant mortality rates and no doubt many other healthcare outcomes are much worse for people of color in the United States than they are for white non-Hispanic people and Asian non-Hispanic people. It's hardly surprising because people of color in the United States are disproportionately poor and thus are adversely affected by our healthcare system. As we see in this next graph, despite spending more money than any other nation in the world, many other countries have more practicing physicians per thousand people in the population than does the United States. As you look at this next graph, which shows what's been happening in our recent pandemic, I'd like to take a moment to try to summarize the graphs we have previously looked at. What we see is a healthcare system that is very good at generating profits in a variety of ways. Insurance companies, pharmaceutical companies, for-profit hospitals and clinics, medical technical companies, all make enormous profits. Probably the most profitable industry in the United States is in healthcare. However, the outcomes are poor because we do not have universal coverage. We do not have any kind of coordination on a national level. We actually lack the kind of system we would need to bring a pandemic under control. In this next slide, what we see is that pretty much all nations have struggled with the coronavirus pandemic. There's no question about that. But there are only two nations that are outliers on this graph, the United States and Brazil. Basically, those two nations have not been able to bring down their confirmed new cases of the coronavirus the way other nations have. In this next slide, we see that the United States and Brazil are leading all other nations in COVID-19 cases. It's not a surprise because in addition to our very inefficient healthcare system, such as it is, we've also had a massive failure of leadership on the federal government level in the United States. The leadership failure has everything to do with why the United States is leading on this pandemic list. We have not been able to do the amounts of testing, the amounts of contact tracing that other countries have done on a per capita basis to bring down their COVID-19 cases. In fact, our president and vice president seem to think that testing is a bad thing because if you have more testing, you will find more cases. However, we all know that the testing does not result in the virus. The virus is there, the testing simply detects it. Uh, we've had no coordination in regard to ventilators, personal protective equipment, contact tracing on the federal level. Now, we know that the federal government can accomplish tremendous things when it wants to. We saw the mobilizations during the New Deal, World War II, building up of infrastructure in the post-World War II United States. The federal government has capabilities that states and local governments simply do not have. But when the government abdicates its obligation to protect the public health, we end up with the kind of results we're looking at in this graph. In this next graph, we see that the United States is not leading in COVID-19 cases per million people in the population. This is no doubt due to the fact that the United States does not have the highest population density. There are many countries that have higher population densities, that is, people per square mile, and therefore some of them have higher cases because of that. What we have seen in the United States, however, is that in regions where we do have high population densities, such as areas of the East and West Coast, uh, cities in the Midwest, etc., we do have very high rates of COVID cases. So while on a national level, we are not leading in this category, on a regional level, we're probably right up there with many of the countries on this list. In this last slide, we're looking at unemployment uh, since the pandemic began, uh, looking really at the years 2018 to April 2020. And what we see is the United States is leading in unemployment compared to pretty much all of the European countries on this chart, with the exception of Spain. That's because, as in the case of our healthcare system, we also have much weaker and more temporary unemployment benefits compared to many of these countries. Japan is not on this list, but it too would show much lower unemployment levels compared to the United States. In conclusion, we have to ask, how can we change this? Where do we go from here? This is not a simple question, and I don't have a simple answer. But I would say that it must seem obvious that if we are unhappy with our health care system, such as it is in the United States, if we're unhappy with the leadership we've seen on the federal level since this pandemic began, and polls show that most Americans are, if we're unhappy because we cannot sustain the costs of our current healthcare system, nor the losses that are taking place during this pandemic, it seems obvious to me that we would have to make pretty substantial changes both to our healthcare system and to our leadership on the federal level as well. To my brothers and sisters in organized labor, I would point out that if we no longer have to bargain over healthcare issues at our bargaining tables, we would be in a much better situation in terms of bargaining good contracts with better wages and better benefits other than healthcare. We spend so much time negotiating over healthcare that that becomes a major focus at bargaining instead of a lot of other important considerations that ought to be negotiated more fully. For everybody who is concerned with what the policies have been on the federal level, I'd like to recommend in the most recent issue of the Progressive Magazine, the June-July 2020 issue, they have a fascinating timeline. It's actually a two-page spread called Crisis, What Crisis, which documents from 2017 through May 2020 all the decisions that have been made on the federal level, which actually amount to a kind of march to disaster. As we are talking at the end of June 2020, the nation is facing actually a worse crisis than we did several months earlier. This is a total fiasco, in my opinion. If you're interested in this timeline, you can get this issue or look on the Progressive Magazine's website, where I believe the article is entitled Smoking Gun Crisis, What Crisis? It's a fascinating timeline. I thank all viewers for your time, and I hope you thought this presentation helpful.